70% of moms tell me they feel completely unprepared for the roller coaster of their first trimester. Sound familiar, Mama? Hi there, I'm Dr. Anna, a maternal-fetal medicine specialist, and today I'm sharing 5 science-backed secrets to not just survive, but thrive in these early weeks. These tips come straight from my years of working with pregnant moms just like you. Stick around, because tip number 3 is a game changer for nausea, and I'll share a powerful relaxation trick at the end to help you feel calm and connected to your baby. Let's dive in and make your first trimester easier, Mama. Let's start with tip number 1, how to tackle morning sickness like a pro. 80% of moms battle morning sickness. Blame those hormonal surges. But here's your anti-nausea toolkit. Eat mini meals 5 to 6 times a day. Crackers, toast, or a slice of apple can stabilize your stomach acid. Ginger is your best friend. Sip ginger tea or eat ginger candies to cut nausea by up to 40%, according to a 2014 study in the Journal of Obstetrics and Gynecology. Sip water constantly. Dehydration makes nausea worse, so keep a bottle nearby. Pro tip: keep ginger snaps by your bed for quick morning relief. After this video, try the ginger trick and comment "Ginger works" if it helps you. Or tell me, what's your go-to nausea hack? Is it ginger, crackers, or something wild like pickle juice? I'd love to hear from you in the comments. Now that we've tackled nausea, let's talk about your superpower in the first trimester: rest. Tip number 2 is all about prioritizing rest to support your body's changes. Fatigue is so common right now because your body is building the placenta to nourish your baby. Rising progesterone levels also make you feel sleepy. The Centers for Disease Control and Prevention says pregnant women need 7 to 9 hours of sleep per night, and naps can help too. I've had patients feel guilty about resting, but I always remind them, your body is doing an incredible job, and rest is essential. Aim for 8 hours of sleep at night, and take a 20-minute nap if you're tired. Try sleeping on your left side. It increases blood flow to your baby. A 2019 study in the Journal of Maternal-Fetal and Neonatal Medicine found this position improves fetal oxygenation. A pregnancy pillow can also help you get comfy. Have you been feeling extra tired lately? What's your favorite way to rest? Maybe a cozy nap or a warm bath? Share your tips in the comments. I'm sure other moms would love to hear them. Let's move on to tip number 3, nourishing your body with key nutrients. This one's a game changer because your baby's major organs, like the heart and brain, are forming now. You need specific nutrients to support this development. Focus on folate. It helps prevent neural tube defects, which affect the brain and spinal cord. The CDC recommends 600 micrograms of folate daily. Find it in spinach, asparagus, or fortified cereals. I suggest a folate-rich smoothie. Blend spinach, a banana, and orange juice for a tasty boost. Get enough iron. Your blood volume is increasing, and iron helps carry oxygen to your baby. The World Health Organization recommends 27 milligrams of iron per day. Try lean red meat, lentils, or pumpkin seeds. Protein is key for your baby's cell growth. Aim for 71 grams per day, as suggested by the American College of Obstetricians and Gynecologists. Eggs, Greek yogurt, and chicken are great options. If nausea makes eating hard, start with small portions of these foods. What's your favorite healthy snack right now? Tell me in the comments. I'd love to hear what's working for you. Now that we've covered nutrition, let's talk about staying active in a safe way. Tip number 4 is all about gentle movement to boost your mood and energy. Light activity can help you feel better. It improves circulation and reduces symptoms like fatigue. The American College of Obstetricians and Gynecologists recommends 150 minutes of moderate exercise per week. That's about 30 minutes a day, 5 days a week. Walking is one of the best options. A brisk 20-minute walk in your neighborhood can increase your energy and help you sleep better. I also recommend prenatal yoga. It's gentle and helps with flexibility and stress relief. A 2015 study in the Journal of Alternative and Complementary Medicine found that prenatal yoga can reduce anxiety in pregnant women. Avoid high-impact activities like running or heavy lifting, and always check with your doctor before starting anything new. Have you been staying active during your first trimester? What's your favorite way to move? Maybe walking or yoga? Drop your thoughts in the comments. I'd love to hear from you. Let's move on to tip number 5. Building a support system to reduce stress. The first trimester can bring a lot of emotional ups and downs. Hormonal changes, physical symptoms, and worries about your baby can make you feel overwhelmed. I've worked with many moms who felt isolated during this time, and I always encourage them to connect with others. Having a support system can make a big difference. A 2016 study in the Journal of Psychosomatic Obstetrics and Gynecology found that social support during pregnancy can lower stress levels and reduce the risk of preterm birth. Start by talking to your partner, family, or friends about how you're feeling. They can offer emotional support. I also recommend joining a pregnancy group, either in person or online. There are many communities for moms in the US where you can share experiences and get advice. Your healthcare provider is another great resource. Don't hesitate to reach out to your doctor or midwife with any concerns. Do you have a support system in place? Who's been your biggest cheerleader during your pregnancy? Share in the comments. I'd love to celebrate with you. Now, I promised you a powerful relaxation trick, didn't I? Here it is, a simple breathing exercise to help you manage stress and feel closer to your baby. I teach this to all my patients because it's so effective. It's called the 4-7-8 breathing method. Find a quiet, comfortable place to sit or lie down. Close your eyes if you feel comfortable. Inhale through your nose for a count of 4. Hold your breath for a count of 7. Exhale slowly through your mouth for a count of 8. Repeat this cycle 4 times. This technique helps calm your nervous system and lower your heart rate. A 2018 study in the Journal of Clinical Psychology found that this type of breathing can reduce anxiety by up to 30%. I encourage you to do this exercise daily, especially when you're feeling stressed. It's also a beautiful way to connect with your baby. Imagine sending them love with each breath. Have you tried any relaxation techniques during your pregnancy? What's been helping you stay calm? Let me know in the comments. I'd love to hear your thoughts. Let's wrap up with a quick recap of what we've covered today. Tip number 1. Tackle morning sickness with mini meals, ginger, and hydration. Tip number 2. Prioritize rest by getting 8 hours of sleep and taking naps. Tip number 3. Nourish your body with folate, iron, and protein. Tip number 4. Stay active with gentle movement like walking or yoga. And tip number 5. Build a support system to reduce stress. Plus, we added a bonus breathing exercise to help you stay calm. These tips are all backed by science and my years of experience as a maternal-fetal medicine specialist. I've seen them work wonders for my patients, and I know they can help you too. You're doing an incredible job, Mama, and I'm so proud of you for taking care of yourself and your baby. Your first trimester doesn't have to feel like a battle. Save this video for those tough days, and let's keep supporting each other. I'd love to hear from you. What's been the most helpful tip from this video? Or what's been the biggest challenge for you in your first trimester? Drop your thoughts in the comments below. I read every single one, and I can't wait to connect with you. If you found this video helpful, please hit that like button and subscribe for more expert pregnancy advice. See you soon, Mama. Take care and keep shining.